I want to thank you for all of you for staying to this last panel. There's a reason this panel is the last panel, because many of the topics we've touched upon today, as you probably realize, are highly dependent on the electronic capture and exchange of healthcare data. So how's it going to be done? Are jails up to the task of actually exchanging data with the community and vice versa? Ever since Estelle v. Gamble in 1976 decided that jails could no longer or could not be deliberately indifferent to the healthcare needs of detainees, a baseline imperative was set for the capture and maintaining of health information concerning their wards, the detainees themselves. As Judy Murphy and I wrote in our Health Affairs article, explains, the jails and corrections in general responded in different ways to this imperative. Of course, many maintained paper medical records. Some adventurous jails even designed and implemented their own electronic health records, EHRs, while others purchased or procured EHRs that were developed specifically for the correctional environment, and others still procured ones that were designed and developed for the mainstream market and then adopted them to corrections. But this data stayed in a silo. Bridges to healthcare in the jail, the siloed off healthcare data, began to be envisioned with the passage in 2009 with the HITECH Act, and then in 2010 with the passage of the Affordability Care Act. So to return to my question, are jails up to the task of actually exchanging this data with the community? I can reply with some positive information. I've been tracking this for about a year. There are many jails now letting RFPs that specifically specify that their EHRs have to be certified electronic health record technology that meets meaningful use standards. And it's not unheard of that jails are participating or planning to participate in health information exchange. So today, to talk about these exciting developments, let me take this opportunity to introduce the panelists, my distinguished panelists. Judy Murphy is the Deputy National Coordinator for Programs and Policy at the Office of the National Coordinator for Health IT. In this role, she coordinates federal efforts to assist healthcare providers and organizations in adopting health information technology to improve care and to promote consumers' greater understanding and use of health information technology. Linda Rosenberg is President and CEO of the National Council for Behavioral Health. Under her leadership, the National Council for Behavioral Health has more than doubled its membership, helped to secure the passage of the federal mental health and addiction parity law, played a critical role in ensuring the Affordable Care Act addresses the needs of individuals with behavioral health disorder. And as we heard this morning, the Excellence in Mental Health Act was passed just recently. Congratulations. And then there is Dr. Homer Venters, is the Assistant Commissioner for the Bureau of Correctional Health Services for the New York City Department of Health and Mental Hygiene. In this capacity, Dr. Venters directs all aspects of health care in the New York City jail system. Dr. Venters received his MD from the University of Illinois and completed his residency in social and internal medicine at Montefiore Medical Center. So